Miss Freeman is a 70-year-old female admitted with chest pain and shortness of breath. She just underwent heart catheterization and was found to have significant coronary artery disease. She just had coronary artery bypass surgery yesterday. She's a pack-a-day smoker and has smoked since she was 20 years old. Her comorbid condition include hypertension, and admission vitals showed her blood pressure at 180 over 90. Her respiratory rate was 22. Her temperature was 99.6, and her oxygen saturation was 97% on 2 liters of oxygen. Her pulse was 110. Since the surgery, they have been stable. They were last checked 1 hour ago, and her vitals were blood pressure over 150 over 84. Respiratory rate was 16. Her temperature was 97.2. Her oxygen was 94% on 2 liters of air, and her pulse was 78. She needs to be educated on her post-operative exercises. So if you guys could do that, that would be so great.
Perfect. Awesome. Thanks. All right, Gabby, so I feel like before we go in and see Miss Freeman, just going over a couple things here. Seems like our primary nursing diagnosis should definitely be your coronary artery disease. I don't know what you think, but that chest pain, shortness of breath, fatigue, dizziness. Her blood pressure is down a lot more, 150 over 84. Respiratory rate's pretty good, 16. Temperature's looking good. She has 94% on 2 liters of oxygen, which is doing a little bit better. But I know that she is really nervous, she said, about going home and taking care of herself. So I feel like maybe that's something we can definitely alleviate with our post-operative exercises, you know?
Yeah.
Yeah.
I think our short-term goal needs to be that she'll be free of chest pain throughout our shift, and then for that long-term goal, it'll be completely off oxygen and that SAT staying above 94% at her time of discharge.
Yeah, definitely don't really want her to go home on oxygen if she doesn't have to.
For sure.
That'd be really great. I think while we're in there, it would probably be a good idea just to go over her meds again. Just make sure she completely understands what she needs to do before she goes home. What do you think?
Yep, let's
Okay,
do it.
awesome. Hello, Miss Freeman. How are you doing today?
I'm alright.
Awesome. Well, my name is Peter, and this is Gabby.
Nice
We're
to
here
meet
just
y'all.
making sure that everything's ready to go before you go home. So yeah, I know you're recovering from your surgery and everything. We got, do you know what medications you're on right now?
No, my son lets me know and then I just take them.
Gotcha. Well, I'm here to tell you that you're on furosemide, and that furosemide is going to help you by reducing the fluid that is still in your body after surgery. It lowers your workload on your heart, so it doesn't work as hard. It prevents the complications like that fluid retention that is sometimes in your lower extremities. It helps clear that excess fluid sometimes from the lungs. It helps you to be able to breathe better, which I know is something that
Well, that's good. I've been having a real big issue with
Exactly, yeah. So it's gonna help that and control your blood pressure. I know your blood pressure's been a little high recently. And it's going to take it down so that you can support that recovery from the heart, and you'll have a little bit less oxygen demand, which will be really great.
And then you're also on that metoprolol, and that's for your high blood pressure. So that's gonna slow your heart rate down, lower your blood pressure, which reduces that stress on your heart. Yeah, and that's gonna help prevent complications down the road. So keep taking that.
Well, thank y'all for letting me know.
Yep.
Awesome. All right, Ms. Marine, do you have any more questions about your medications before we go into our exercises here?
No.
Okay, all right, so for our first exercise, we're gonna do deep breathing, okay? So how this works, it's gonna help help you to be able to breathe a little bit better. We're gonna use that diaphragm to breathe instead of some of those accessory muscles. So what I want you to do is put both your hands, put them on your stomach right here, okay? What we're trying to do is push the stomach out when we're breathing, okay? We don't wanna use our accessory muscles, our shoulders, any of that. We wanna use our diaphragm. So when we breathe, we're gonna focus on pushing that abdomen out, okay? Does that make sense?
So I just push against my hands.
Yeah, a little bit, yeah, exactly. So what we're gonna do first, okay? We're gonna breathe a big, deep breath through our nose. Then we're gonna hold it for 3 seconds and then blow out with our mouth. And when we blow out, we're gonna blow out like we're blowing out a candle. It's called pursed lip breathing, okay? Whenever we do that, it's gonna help those alveoli in our lungs to be able to expand so we can breathe easier, okay? You're gonna try it with me, all right?
Okay.
Exactly, one more time, go ahead and do it. Deep breath in, hold it, 1, 2, 3, blow out. Awesome, one more time, ready? Okay, now what I want you to do, okay, is when we take a deep breath in, we'll take a deep breath in, and then we're gonna cough right after, okay? We're not gonna breathe at all in between coughs, but cough 2 or 3 times. This is gonna help get up those secretions from our lungs,
Do
okay?
I have to keep my hands here?
Yeah, you can, right? Cough. Awesome, okay, great. That's gonna help get those secretions up and everything. Does that sound good?
Yeah, can I have a tissue?
Yeah, we can get you a tissue. Is there anything else that you need? Do you have any questions about this?
I don't like Ella, but it's okay.
Okay, all right, it'll help us. It'll help us, trust me. All right, thank you.
Okay, Ms. Freeman, so this is called a positive expiratory pressure device. And it's going to be helping you expand your lungs, take good deep breaths, and prevent any other complications from occurring. So make sure when you use this, you're in a semi-Fowler's to high Fowler's position, so you're sitting up. Like you are now, you're in a good position now. And then you're going to take this, and you're going to put your mouth around it, make sure you're breathing only through your mouth. And you're going to breathe in like normal, and then you're going to breathe out 2 to 3 times longer than you breathe in. And I want you to do it 10 to 20 times.
So is this like the incentive spirometer?
It's similar, but with that, you're trying to see how far you can breathe in. And then with this, you're trying to breathe out 2 to 3 times longer than you breathe in.
Okay.
So just do like 2 breaths for me.
How was that?
That was good. Do you have any questions for me?
No.
All right, sounds good. Okay, so this is called an incentive spirometer. It's going to help get your lungs nice and healthy. It promotes full lung expansion so you can get a nice deep breath. So it's going to help prevent your lungs from collapsing or getting infections like pneumonia and stuff. So I want you to use this 10 times every hour. I know it sounds like a lot, but I see you're watching TV in here, so maybe every time there's a commercial, try and get 2 good breaths. Does that sound like a plan?
I can do that.
So to do the breath, you're going to put your mouth on this piece here. You're going to take a big deep breath all the way up to this 1500 mark. You're going to hold it for 3 to 5 seconds, and then you're going to breathe out normally. Does that make sense?
And what does the 1500 mean?
So that is what your doctor wants you to breathe into. So that's going to be your goal.
Okay.
Any questions for me?
I don't believe so.
Okay.
Did I do
Good.
it?
Yeah, that was good. So you don't have to do all 10 at once. You can split them up throughout the hour and try and get 10 every hour.
Okay.
All right. Sounds like a plan.
Go.
All right, Miss Freeman, so now that you're done with that, we're gonna go ahead and do some post-operative exercises. These are gonna help you make sure that you don't get a deep vein thrombosis or a blood clot, making sure that your blood stays moving and circulation is going. Does that sound all right?
Okay.
Okay, awesome. All right, so what we're gonna do, I want you to lay down flat. Okay. Go ahead and watch me. What we're gonna do here, we're gonna do this thing called leg pump. Okay, what we're gonna do is you're gonna take your foot, move it back towards you, and then push out like that. Move back towards you and push out like that. You try for me? There you go. And you do that each time with each foot 10 times. Seems like you got the hang of it.
Can I do them at the same time?
Yep, you can do it at the same time. Awesome. Great. Okay, so for our next exercise, okay, we're gonna do these leg circles, okay? What we're gonna do is you're gonna take your foot, move it around clockwise, like this, do that 5 times, then go counterclockwise. You'll do that with both feet. Perfect. Awesome. Okay, so now we're gonna do knee flexion and extension. So you'll take your knee, okay, take your knee and push it up towards your butt, okay, and do that 5 times
Can I
each leg.
support it like you did?
Nope, you'll just do it like you are now. Yep. Perfect. Great. Awesome. You'll do that about 5 times with each leg. Does that sound alright?
Yeah, I can try.
Okay, Miss Freeman. So for our next exercise, we're gonna do leg lifts. Okay, so you take your leg out straight, and then you'll just take it a couple inches off the bed and put it back down. Okay, you'll do that a couple times, both. You can do that about 5 to 10 times at each leg. Okay, it's gonna keep the circulation moving. Make sure we're moving.
Like that.
Yeah, exactly. Good job. That's great. Okay, so for our next exercise, okay, we're gonna do these gluteal exercises where you squeeze your butt together. Okay, make sure all that circulation's moving, and we're just keeping all of our muscles working. Okay, does that sound good?
Yeah,
Okay, go ahead and do that for me.
I'm doing it.
Okay, great. Do that about 10 times, along with all the other exercises. Sound all right?
Okay.
Okay, awesome.
Hello, Miss Freeman. I'm just here to tell you some things that we can work on in the future after you're being discharged. Are you able to turn yourself and move yourself around in your bed?
Oh yeah, I get up and I walk and I do it all.
Okay. So I was just wanting to make a suggestion of you turning yourself like on your side every once an hour or so. Just switching off those bony prominences so you're not at risk for any pressure ulcers. Because those really hurt. We don't want you to have any of those. Yeah. And I heard you like smoking.
Oh yeah, I gotta get my pack in each day, girl.
Yeah.
You know me.
Yes.
I'll be outside smoking.
Yeah. Well, we're thinking maybe it'll help you get better faster if you try to lay off the cigarettes. And I know it's hard, but there are nicotine patches and gums available for you, or you can just start decreasing your cigarettes daily, just helping out with that.
They gave me a patch while I was here, but there's nothing like the smoke going down your lungs.
Oh, yeah. And there is daily exercise, and you don't have to weight lift or anything. Just going on a 30-minute walk is good enough. Maybe even when you're smoking your cigarette.
Yes, that is what I love, to take walks. I walk along my property, just letting it blow.
Yeah, and there are relaxation techniques. I know you have high blood pressure, so like the breaths that you did earlier, that will help you out.
The ones with that male nurse that was in here?
Yes, that can help you, just taking a deep breath, just calming down. That can help with lowering your blood pressure as well. And I know you were wanting to, I know you live alone.
I do,
Okay.
yeah.
And you're just scared of after like being home alone after this surgery.
Yeah, my son, he comes over every day to give me my meds, and that's about all I like him to do, because I just don't want to be a burden to anybody. Like, I don't want to put that on anyone. And I like being able to do my own stuff, so I just don't want anybody to take care of me.
I can connect you with our social worker, and we can actually provide you with some services here in Kingman County.
Okay.
And so you're not a burden for anyone. You have that support that you need.
Oh, well, thanks for saying
You're
that.
welcome. And there are healthier diets too that can help you with your recovery. Just having those whole foods, fruits, veggies, all the good stuff, and having low sodium, which is just less salt. When at the grocery store, you can look for packaging that says low sodium or no salt added. There are also like cooking your home cooked meals. And not eating from packaged foods can help you out a lot too.
Yes, out on the farm, we grow our own fruits and vegetables. We make that salsa fresh every year.
Okay.
So I get how that is,
So that's perfect. So do you have any questions for me?
No, I think that was it, but thank you so much for coming and
I hope
talking
you get
to
better
me.
soon.
Oh, thank you.
Yes, you're welcome.
Hi, Miss Freeman. How are you doing today?
Hi, I'm doing okay.
Good. Are you ready to get out of here? Feeling
Yes,
better?
I am ready for my own bed and the nice breeze blowing through, and I'm just tired of this hospital.
Oh yeah, I bet. Me too. Well, whenever you get out of here, I'm gonna give you some community resources you can use whenever you leave, because I know you don't want to be a burden to your family.
Yes, I
That'd
like
be
doing everything
really
myself,
beneficial.
so.
Yeah, of course. Well, at Ascension View Christi St. Teresa Therapy Center would be beneficial for you because it offers so many different post-surgical therapy options. You could do physical therapy, occupational therapy, sports therapy, which probably won't.
I don't think that one doesn't account for me, but.
And orthopedic surgery and post-operative rehabilitation.
Oh, that one would be
Yeah,
for me
of
because I
course.
just had that coronary. Yeah.
The care team provides specialized therapies to help support recovery after your procedure. So it would be really great if you want to pop in and they'll help you through all of that.
Okay.
Yes. Do you have any other questions for me?
No.
No? Okay. Well, I'm really really glad you get to go home soon. I hope
Thank you,
have
me
fun.
too. While I'm waiting, could I get a blanket? It is a little cold in
Yes,
here.
of course. I'll bring you a
Oh,
blanket.
Thank you so much.
Yeah, of
Everybody
course.
has been so nice and kind.
Good. I'm glad to hear that.